All right. The contents of this presentation reflect the views of the presenters, and they do not necessarily reflect the official views or policies of the Department of Drug and Alcohol Programs or the Commonwealth of Pennsylvania. So as many of you may be aware, the federal guidelines issued through SAMHSA's April 24th Dear Colleague letter changed how federal funds can be used for certain harm reduction supplies, including drug test strips and other drug checking materials. In response to this updated guidance, DDAP will no longer use federal SAMHSA funding to purchase drug test strips or other drug checking supplies. Recognizing the important role these tools play in overdose prevention efforts, DDAP quickly identified an alternative funding source to support the continued purchase and distribution of test strips. As a result, the Overdose Prevention Program has continued operating without interruption, and partners who rely on the program can expect no changes to the current scope of services or access to drug test strips. This action reflects the Shapiro administration's continued commitment to harm reduction and overdose prevention. Ensuring uninterrupted access to those supplies helps individuals make more informed decisions, reduce overdose risk, and stay connected to life-saving resources and supports. So drug checking data helps us stay informed about emerging substances and changes in the drug supply across Pennsylvania. The resources on this slide provide valuable information that can support your overdose prevention efforts, inform harm reduction messaging, and increase awareness of local trends and risk. The Pennsylvania Department of Health's latest overdose surveillance data is also available for reference and provides preliminary overdose death estimates as of May 2026. While 2024 estimates show encouraging declines, approximately 29% fewer drug overdose deaths and 35% fewer opioid overdose deaths compared to 2023, the number of drug overdose deaths occurring in 2024 were still 57% higher than the number of deaths seen in 2012. So despite recent decreases in fatal overdoses, trends in non-fatal any drug overdose among Pennsylvania residents in 2025 show a 7% increase compared to those seen in 2024. And these slides will be available and sent out after. So I won't spend time reviewing the learning objectives on this slide, but they are provided here for reference and outline the key topics we'll be covering during today's training. So our main presenters, Dr. Lieberman, Professor of Chemistry and Biochemistry at the University of Notre Dame. Her laboratory has conducted extensive research on drug checking test strips, examining issues such as false positives, detection limitations, and test strip performance. We are grateful to have Dr. Lieberman with us today to share her expertise. Please join me in welcoming Dr. Lieberman.
Great. Thank you so much, Samantha, for this chance to participate. Yeah, my name's Marja Lieberman, and I would like to sort of give an intro to fentanyl test strips. And I want to start with sort of how they're constructed because they're a manufactured product. And so if we understand how they work, then that helps understand their strengths and limitations. So this is sort of an overview of what I'd like to show you. So from the principles of how they work, I then want to go to sort of best practices for how they should be used, and also some guidance for training and distribution across different settings. And then that theme is going to be picked up by Rose and Carter, and they're going to have much more sort of on the ground input about their use of test strips in programs. Okay, so at any time, if you have a question, please feel free to drop it into, there's like a Q&A thing and there's a chat window. So we can use either of those things. And the goal is to have some time for questions. So here we go. All right, so the goal of drug checking, as you know, is to help reduce overdose. And the way it does that is by providing actionable information. And what information you can provide depends on what your technology is. So I was recently up in Victoria, BC at the Substance drug checking location, and they have their own tandem mass spec there. That's a very sensitive and powerful instrument, and it can provide really detailed information about high potency opioids and benzos and nitazines that are being detected in the drug supply close to real time and with concentration information. And that kind of information is really useful for people to make safety plans. And what we're talking about today is fentanyl test strips. And of course, those test strips are not as powerful as the confirmatory tests that you do with a mass spec. And so I want to really focus on sort of strengths and limitations of the test strips, and then how you can articulate a test strip program with a confirmatory analysis program and get some of this kind of information. Okay, so one of the issues with test strips is that there are lots and lots of different kinds of test strips. And so we have to understand test strips are not just a single product, right? There's, even if you're just talking about fentanyl test strips, all fentanyl test strips are not exactly the same. And so there's a lot of nuance there. And so I want to unpack a little of that. And then also we want to talk a bit about how to maximize the benefits that participants will gain from working with test strips. Okay, so let's take a look at the anatomy of a test strip. And if you happen to have a test strip handy, you can follow along. Just open up the little pouch and take out the test strip, and you can look at it and see these little parts. And so when I show the test strip, I also like to use this big test strip model here. So you can see there's the end that you hold with your hand. There's the control line, which is the top antibody line. There's the test line, which is where my white fentanyl balls are binding. And then there's the end that you dip into water, which is I'm denoting here with the little wavy lines. And underneath this, all of these labels, there are pads. These absorbent pads hold important reagents for the test to work. And so if you look at the side of a test strip, what you'll see is you'll see the thickness of the pads underneath the labels, and then you'll see usually a pink or red spot, and that's the conjugate pad. So the conjugate is the red color that's going to wind up binding to the test or control lines on the fentanyl test strip. And all lateral flow antibody test strips work this same way. And so, okay, so let's move on from the anatomy of the test strip and look more inside. And I want to focus on the nitrocellulose, which is where the readout of the test occurs. So this is like that little central white patch in the lateral flow test strip where you read the result of the test. And there's lines that might turn red or that might remain the white color of the background. And those lines are critical for making this test work. And they're made by drawing a line of an antibody along the nitrocellulose. And the antibody will stick to the nitrocellulose, and that enables it to bind to the red conjugate or to the fentanyl. Okay, so let's move along a little bit. So these lateral flow tests are all based on the use of antibodies, and antibodies are a wonderful, versatile analytical tool because we can generate antibodies to most small molecule targets. And so those small molecule targets, in our jargon is we call them antigens. The antibody recognizes its antigen, and that interaction is a very specific binding interaction. So if that target molecule is there, the antibody has a very high ability to detect it when it's there. And if there are other molecules there, the antibody will reject them. It won't bind to them. Okay, so we have a sensitive and specific component that can recognize our target. In this case, our target would be fentanyl. Okay, so one of the strengths of the lateral flow test is that it's really easy to use in field settings. People can even use them in a home setting. And so that is not true of other analytical instruments like the mass spec at the substance lab. One of the limitations, though, of using antibodies is that if you have high concentrations of something that has a small ability to bind to the antibody, that can act like it's a false positive. Okay, so when you have high concentrations of cutting agents like lidocaine, meth, MDMA, diphenhydramine, these are all things that are known culprits for causing false positives. And you have to understand that manufacturers are always they're in a sort of a whack-a-mole state. So as soon as they figure out that there's a serious interference from substances like meth or MDMA, they go and they try to find better antibodies. And so in 2021, 2022, when we started testing lateral flow fentanyl test strips, the interactions with meth and MDMA were pretty common and would cause false positives on fentanyl test strips. And the versions that are now being produced are don't have that interference anymore. So this is one of the reasons why it's really important to communicate with people and to connect up with confirmatory testing, because this information, when we find an interference like this, the manufacturers can respond to it, and that improves the function of the technology. So, for example, this is a test strip here. This is a benzo test strip, and a group in, I think it was in Colorado, said that they thought that they were getting false positives with acetamiprid, which is like a pesticide. So I got some acetamiprid. I was like, this is no way is that going to cause a false positive. It might be something else. I was wrong. This is acetamiprid definitely caused a false positive. Unfortunately, there are only like 2 recorded cases where acetamiprid showed up in the drug supply. So it's not a common thing. But one of the common things that we are dealing with now is interference by lidocaine with xylazine test strips. And so lidocaine is maybe not I guess it depends, it's a regional contaminant maybe, or a regional cutting agent. So this is why it's really important to know about your particular brand of test strip and whether it has any known interferences. And this is information that the manufacturer should be willing and able to provide you when you're in procurement stage. One of the fundamental limitations of antibodies is that the antibody doesn't bind to the whole molecule. So here I have a model here of fentanyl. And when antibodies are trained to recognize this molecule, the fentanyl molecule is held by like a helper protein, and the antibody learns to recognize a part of the molecule. So maybe one antibody might learn to recognize this part of the molecule, and another antibody might be trained and learn to recognize this part of the molecule. And so those different antibodies then will have different abilities to recognize fentanyl analogs. So we did a study with about more than 200 synthetic fentanyl analogs, and we found that there's a lot of overlap. We had 121 compounds that were detected by both test strips, but then there were some compounds that could be detected by one brand of strip and not by the other, and then vice versa. So each strip had sort of strengths and limitations in terms of the analogs that it could detect. Some of the challenges that we encounter using drug test strips for drug checking is that the drug supply is unregulated and rapidly changing. And that means that the targets are complex mixtures. We often are dealing with analogs, and then sometimes there's unusual dosage forms, like perhaps tar heroin or smokables. And so there's often a lot of questions about that. Another issue is that right now the drug test strips that are not from a regulatory standpoint, they're not medical devices. So the FDA is not regulating them to make sure that they're fit for purpose. And often there are a lot of manufacturers and distributors that are out there. And so when a new strip comes on the market, or even a new batch of a strip that you're familiar with, there may be changes in the antibody that's used in the strip or in the manufacturing methods, and those can affect the way the strip works. And so that's one of the ongoing things we're trying to persuade companies to have more of an indication when they change their recipe, so we can understand better how the strip will perform. Another that it kind of fits into challenges for procurement. There are some papers out there. Researchers are trying to test these strips to make sure they're fit for purpose, but we are all testing different brands and batches, and we're not all using the same testing methods. And there are some locations where the brands of strips that may be purchased are specified using a performance-based standard. There are other jurisdictions where lobbying or aggressive marketing has a lot of impact on what strips are allowed to be purchased. And then lastly, consumers can buy test strips directly from various e-commerce sites. And a lot of these strips, I've never seen these brands. I have no idea how well they work. Um, there is now a voluntary regulatory standard for drug test strips. It's organized by the AOAC, which is a sort of like a food regulatory agency, food and environmental compounds. And so they worked with NIST and with a bunch of stakeholders to develop a pretty good standard protocol for doing this testing. And right now, we're trying to get some companies through this process. And I'm hopeful that we'll have some brands of strips that have gone through this testing process by the end of the year. We'll see. So let's talk now. I'm going to sort of change gears and now kind of move into talking about what are good practices for using and training people about how to use drug test strips. And so I think a really good starting point is you have to figure out what would be actionable information for a person, because that will really guide what kind of test strip they should use, and then also how you counsel them about the results. So if people who are at a dance festival or something and are using drugs like Molly, they might test for fentanyl because they absolutely don't want to take fentanyl. And so those people would be good candidates for fentanyl test strip. They're likely to have an action that is highly protective. They probably won't take that drug. People who are using opioids might not react that way to a positive fentanyl result, but if there's a positive xylazine result, then that might have much more impact on their behavior, because they've heard about wounding that xylazine can cause and they don't want it. So when you give out test strips, you want to help people understand the strengths and weaknesses of the strips and how the result of the strip could impact their behavior in a way that makes them safer. There's another best practice is you need to give people equipment there's sort of a minimal amount of equipment that's needed for using the test strips in the most effective way. And then also we would like to, if possible, to do hands-on training rather than a webinar like this. I think hands-on is much better, faster. Some of the nuances that are really important to convey when you're training people are to sort of get it clear in their mind that the drug test strips work sort of backwards to other tests they might be familiar with, like COVID tests or pregnancy tests. And so they have to understand how to read the strips. And then often the test strips give results that can be hard to interpret. You may get false positives. You may get faint test lines. And then it's possible for a strip to miss a product that's really there because the concentration in the sample is too low. And so people need to understand these things in order to understand the limitations of the device that they're using. And then all of this training gives you a chance to start a conversation with a person who's using drugs in a new way. Maybe a lot of people who use drugs have been talked at a lot, but this kind of gives you a new angle that's focused on their safety and their planning for the future. And then also it's really helpful, as I mentioned, to get feedback from test strip users if they feel like the test strip result isn't consistent with their experience. And then to have access to confirmatory testing is really helpful. Okay, let's take a look at this critical issue of sample preparation. The standard way to prepare samples at this point involves using a simple volume measuring device like a bottle cap and a little microscoop. And these microscopes hold about 10 milligrams of powder. And the bottle cap holds roughly a teaspoon or 5 milliliters of water. And so these two simple tools together will produce a nominal 2 mg per mil concentration of sample. I'm sorry, I'm going to be a little bit mathematical here because I want to link sample preparation to the ability of the strip to detect the substance. Okay, so the powder method gives you a nominal 2 mg per mil solution. And then sometimes some groups are using either rinsing out a cooker or a water container that has held a drug material. And that residue is a lot more dilute. The nominal concentration might be 0.1 mg per mil or less. And let's take a look at how those two samples would behave when you have a fentanyl test strip and a real sample. So if we had a real sample of injectable drug with a fentanyl concentration of 4% of the dry weight, which is, at least in our area, the Midwest, is a fairly typical fentanyl concentration. And we're using a standard fentanyl test strip with a 200 nanogram per mil limit of detection. Now you can see that the nominal 2 mg per mil concentration, when we multiply that by 4%, which is 0.04, we'll get our fentanyl concentration, which works out to 80,000 nanograms per milliliter. And so this calculation here shows that the fentanyl concentration is well above the limit of detection for the fentanyl test strip. And this is part of the reason that fentanyl test strips on these kinds of samples are highly reliable indicators of the presence of fentanyl. Even for cooker residue or other kinds of drug residue, the concentration from that kind of a more dilute sample is expected to be 4,000 nanograms per mil. So you still have quite a margin of safety for detection of the fentanyl at a physiologically relevant concentration in the sample. Okay, now let's take a look at, instead of fentanyl, we're going to be using a medetomidine test strip. And again, we'll have a typical concentration of medetomidine is quite low, usually less than 1% of the dry weight of the sample. So here I've used 0.5%, and that's an amount that we've measured in samples from Ohio, actually. Most medetomidine test strips, the limits of detection right now are typically around 2,000 nanograms per mil. And so if the sample's prepared using the microscope and cap full of water, then the calculated medetomidine concentration would be 10,000 nanograms per mil. So it's still detectable by the medetomidine test strip. But if you're using a more dilute sample, then with this cooker wash method, the medetomidine concentration drops to around 500 nanograms per mil. And with the current metatomidine test strips, that may be missed. Okay, so there could be a physiologically relevant amount of metatomidine, but the sample is so dilute that the test strip misses it. So, so that suggests that people should be using this this top sample preparation method for metatomidine detection. Why not just make a more concentrated sample? Well, now the problem is you might start to run into false positives with cutting agents. So for example, most test strip manufacturers are testing their interferences up to about 2 mg per mil concentrations. And so if your nominal concentration is higher, if you're putting 5 microscoops into your cap full of water, now you've got a 10 mg per mil concentration, and your lidocaine, if you have a lidocaine cutting agent, that may trigger a false positive on some brands of fentanyl or xylazine test strips. And of course, there's many other cutting agents that could have this effect on different kinds of test strips. So try to keep sample prep at a nominal 2 mg per mil. All right, Megan Reed did a really good study in Philadelphia. She worked with people who use drugs. She observed them using test strips on sort of simulated drugs. And what she found was that nearly every single person in the study made serious mistakes. And they were using test strips with the package instructions and with previous experience using test strips. And she saw people making solutions incorrectly, but also things like dipping the strip in the wrong end of the strip into the solution, or reading the results at the wrong time, or and very strikingly, more than half of the people did not read pictures of strips correctly. So they thought that 2 lines meant that there was fentanyl, or they misinterpreted faint test lines. I thought this was a really striking result, and it really highlights the need to do some sort of formalized training when strips are distributed. Best practices for doing training, hands-on is the best. And then also you need to communicate with the person you're training so you know what kind of substance they're trying to test and what materials they have available to do the testing. So if they don't have a bottle cap available, how can they measure water, right? And then I think in light of Megan's results, I think it's really important to give people practice in reading strips, including strips that show faint test lines. And you can do that using pictures of strips, and just to give something to make sure that they're reading them correctly. And then it's also really important to incorporate, not just give them this tool, this technological tool, but also to use it to link them to harm reduction behaviors and link them to other resources for care. Okay, so how are they going to use the results? How is that actionable for that person? I have some slides that have training content, and you're welcome to use them or adapt them. My experience is this takes 20 to 40 minutes working with a small group. So we may not have time to do that all today. I'll just kind of blow through the slides. But yeah, so I mentioned that confirmatory testing of used test strips can be really handy, and I want to give you 2 examples of that. So first is when you're doing confirmatory testing of used test strips, that can help you understand if the target was really there, or perhaps if there were potential interferences with the strip. And so, for example, we had metatomidine test strips that were provided by MADS in Massachusetts. We were able to extract the drug residues from the strips and analyze them by mass spec. And what we found was that all of the positive strips really did have metatomidine in them. And one of the negative strips had a very small amount of metatomidine. And we sort of back calculated, we figured that the original solution that was tested with that test strip was probably below the test strip limit of detection. And so conclusion is A, the metatomidine test strips worked, and B, sample prep, really, really important for metatomidine strips. Okay, one more example. I had heard reports that tar heroin would cause false positives on a fentanyl test strip. And I collaborate with a police lab up in Berrien County, and they were able to provide me with some tar heroin, and we ran it on test strips, and lo and behold, it did cause a positive on the test strip. But when we extracted the drugs that were on the test strip and looked at them with the mass spec, we found there really was fentanyl in that tar heroin. And we tested the tar heroin sample directly, and we found, yes, it did actually contain fentanyl. And so the test strip was really doing its job. And this sort of highlighted, people had been assuming that tar heroin was some kind of like pure heroin that didn't have fentanyl. And that's not the case, that it can be mixed with fentanyl. So that's really useful information. If you are interested in accessing confirmatory testing for used test strips, the NIST radar program can provide that for partner agencies. So if you're part of an OD2A program, I believe that they'll provide that service. And if you don't fall into that category, you can contact me, and we do partner with organizations. I can't do it for individuals, but I can do it for organizations. And so we can also provide that kind of info. Big fentanyl test strip model. Again, you're going to get these slides. This is kind of a useful teaching aid. You can use it to demonstrate how the test strip works. You can show a positive test, you can show a negative test. The next two slides have information about what you need to purchase, and then how you assemble this. And so again, I'm not going to run through this, but you are welcome to look it over. If you have questions, email me. We can have a craft hour. And if you do make a model, please send me photos. So this is the substance drug checking clinic in Canada. They said they decided to go big, and that's an enormous one. So I mentioned that I had some fentanyl test strip training content, and I'm going to check in actually, Samantha, how much time do we have until the next speaker? Because I don't want to go over my time.
You have a few more minutes.
Okay.
But we can also come back to it during Q&A.
Okay.
If need be.
Okay, so I think here I just want to sort of show what I've got here, and then if people have questions, again, I'd be happy to go over this with anyone who wanted to implement and had more questions. But these are supplies that are needed, just test strips, some mock samples, a little scoop if your brand of pouch fentanyl test strip doesn't include them, volume measuring device, and then there's sort of 4 activities that you do. You unbox the strip, where you take it out of the pouch. You show people all the things they need to know about the test strip. You prepare a sample, test the sample, and then read the result. Okay, so for unboxing, again, in each case, there's information about why it matters and what the key messages are that you should be conveying to your trainees. When you open the pouch, you see all the different types of labels. They come in different colors. They have different markings for which end you should immerse in the water. Some have a max dipping line and some don't. And then some time to get questions from people. How to prepare samples, very important. Some of the nuances of how to do this. And then the testing process here. And then for reading the test strip result, there's sort of 2 stages you go through. The first is the simple stage. 2 lines is negative, 1 line is positive. No has two letters. I find that quite useful. And then The second stage is you have to talk about faint test lines. And the best way to do that is to show people test strips that have faint test lines. So I have here's some pictures of different types of test strips. Some show positive, some show negative. So you can go through those. Here I've slipped in a ringer. So this test strip here is positive, but it's not positive for fentanyl because as you can see in this tiny little type up here, that's a xylazine test strip. Okay, so that maybe isn't interesting. Okay, one of the things you can really do with the test strips is use them as a tool to open conversations. What are people worried? What are you worried might be in those drugs? What's your plan to be more safe? And then you can talk about harm reduction messaging. When we started working with test strips in South Bend area, we found that most people had not been exposed to this kind of harm reduction messaging. And so that was actually really helpful to incorporate. And then I think it's also useful to be explicit that we're going through this training because oftentimes people who know how to use test strips will help other people in the community. They may test a substance for a friend or train a friend in how to do it. And so you want them to have a good understanding of what the best practices are and sort of why. Why are you doing these things in the way that we're training you to do them? And that will make it stick better. Okay, and I think at that point I will hand off to Rose.
All right. Thank you so much, Dr. Lieberman. Hi, everyone. My name is Rose Lorano. I'm the Harm Reduction Manager from the Philadelphia Department of Public Health, the Division of Substance Use Prevention and Harm Reduction. Thank you all so much for being here. Obviously, a huge thank you to Sam and the DDEP crew for their incredible work. I'm very honored to be here today with Dr. Lieberman and Carter and Julia, who you will hear from shortly. As an overdose prevention partner at PDPH, I am just going to briefly identify some practical approaches to distributing test strips across a range of community and program settings, primarily by walking you through our distribution model and methods here at PDPH, as well as some lessons learned. So we distribute via a few different routes. We distribute internally, so we have our own community engagement team. Some of them are actually here today. They're awesome. They distribute via tabling, as well as street engagement and other forms of community engagement. We also distribute to external organizations as well as individuals. People submit requests primarily through a form on our website or over email, but we also receive in-person requests. So we receive requests however people want to submit them. We fulfill requests in multiple ways. We provide pickup hours Monday through Friday. We have a variety of delivery options or discrete mailing for individuals or smaller amounts, as well as the outreach that I mentioned. We found that just pickup did not meet the needs. Not everyone has a car. Sometimes people need larger amounts, but delivery for all orders was not feasible for us. And if we offered delivery as an option up front, for some reason, that was what everyone selected. So we provide our pickup hours. And if someone says that doesn't work, then we offer delivery as an additional option. And that works very well. The first method that I want to highlight with regard to distribution is targeted distribution. So what do I mean by that? I mean that medetomidine test strips, for example, are expensive. So there is a limited quantity available. So that means that I want to make sure that they get where they need to go. So if someone requests, say, 500 medetomidine test strips, to be distributed at a pride parade in Center City to people primarily using club drugs, when I know that metamidine in Philadelphia is currently primarily in our illicit street dope, I'm going to deny that request. I'm going to talk to that person and I'm going to redirect them to the resources that will serve them and their population better, because I want to ensure that those metamidine test strips are going to end up where they will serve people the best. So I'm going to ensure that the distribution of the resources that I have are going to get where they need to go. So especially when I have limited resources, trying to make sure that they end up where they will do the most good. We also offer education with all of our test strips. So we offer written materials. Those written materials cover how to use all of our test strips, but we also offer verbal education. So it's going to cover what's the best way to talk about test strips, particularly during street engagements where time might be more limited. We'll touch on this a little bit more momentarily. We also offer more formal education. So we always offer training. We offer train the trainer trainings. Those trainings can be virtual, they can be in person, they can be for organizations, they can be for individuals. Obviously, all of them are free. There's no requirement for people to take trainings for them to access test strips or resources, but we do try and make them as convenient as possible. And explain the importance whenever someone does access supplies. One of the things that we specifically discuss with our distribution partners, and one of the things that we use in our own distribution for test strips, is recognizing test strips as a tool for both building familiarity and a tool for building engagement. So what do I mean by that? And Dr. Lieberman touched on this just a little bit. Recognizing that, for instance, when metamidine came into the supply, a lot of people hadn't heard about it. So metamidine test strips became an opportunity to teach people about metamidine, to say, have you heard about this? To say, this is a new substance in the supply, to get the word in front of people so that they could become familiar with it, so that they could say, hold on, what are you asking me to test about? What is this new substance? So using it as something to teach people about the drug supply. So you are now familiarizing people with a substance that they might not have heard about. I think there is huge value in test strip in terms of that as a education tool. Additionally, and again, Dr. Lieberman talked about this a little bit, but like building engagement with the test strip. So with fentanyl test strip, talking about naloxone, moving that conversation to overdose reversal. How do you then say, like, have you been trained in overdose reversal? If it does come up positive, like what steps would you want to take? If it's a xylazine test strip, do you have experience with xylazine wounds? Have your friends had xylazine wounds? Do you have access to wound care? Do you have access to wound care kits? We also distribute wound care kits. Do you know where to get them? Do you want them? Being able to have those next steps ready, being able to have those resources on hand. And obviously with metamidine test strips, are you familiar with metamidine? Are you familiar with metamidine withdrawal, the signs of metamidine withdrawal? Are you familiar with when to go to the hospital? So just all of these conversations that you can have around the drug supply, and really using test strips as that first step to then engage further with participants and with clients. So supporting our partners in how to build out those conversations. And then fundamentally, just the takeaway is just supporting as low barrier distribution as possible. So we don't require reporting. We don't require education. Like I said, But we pair our distribution with as many opportunities for education and as many opportunities for conversation and as many opportunities for other resources as possible. So we try to be as prepared to provide those as possible, but we don't require them because we recognize that any barriers do limit that access. And we do want to make sure that that access is there. So I don't want to go over time, and I think that's it. And I think I am passing it off to Carter.
Please God, no. I'm such a nervous public speaker. Hi, I'm Carter Graves. I'm with PA Groundhogs. We're a community-led drug checking initiative based in PA, but we service the entire United States for individuals. And then we also take on partner organizations that want to add drug checking to their program. We can do that on their behalf through our dashboard and help facilitate them servicing people who use drugs best. Lost my train of thought. Oh my God. Again, nervous public speaker. So anyways, I run the entirety of the statewide kit program. If you've ever requested a kit through our website or received a kit at all, I have mailed it to you personally, and I have designed these from scratch. I am a person with living experience. I am a current person that uses drugs, and I use everything that I learned through myself and through doing engagement in communities that do not reflect my own. How to develop practices that can best fit everyone's needs. Because of this webinar, we decided to pull our data. We've been operating for 3 years. We have a few questions on our survey about drug checking and what tools that you may have used already before sending it in to us. We had 1,523 samples over the past 3 years. 482 of those have reported using any strip whatsoever. 92 reported using a reagent chemical panel, and 14 reported using that they had already sent it to another lab and they wanted more information. And we have the the full breakdown of that report will be going out end of day tomorrow. So you'll be able to see the breakdowns for every kind of strip somebody self-reported on, what machines they had used, stuff like that. So you can really see, like, are we being effective with our distribution efforts? And that this whole thing made us question, like, are we being targeted? Why are so many people reporting that they're not using anything at all? Like, why are they skipping over that question? So in the field, what we decided to do, next slide. People are answering the question, so maybe it's the way the instructions are done. We were in the field for a music festival and noticed that people were failing an open book picture test. And so with that, we're like, okay, so where are our failings? We decided to remove colors from the strips because hyper branding has resulted in all these varieties. And for a long time, we've just been like red scoop, blue wavy end. And that's not true anymore. I mean, I have 3 different brands of strips and scoops from each of those brands. Your directions can no longer say just the red scoop. If I pull out a yellow scoop, I go, well, is this right? Am I doing it? I don't know. And when people lose confidence, they get different outcomes and they lose faith in the drug checking technology itself and don't form those habits. It seems like a little hiccup that somebody could go forward on. Some people really get stuck on that. So we just removed color entirely from our communication. We've also gone with what a strip description looks like. So wavy end down. So water to water or dip the dots. try to make it really easy for people to remember. We all hear this phrase. We're all familiar with it. A lot of communities PAG has reached out to. We've never actually been able to add anything to our program because they're in a rural environment. They have a population of 400. 80 of those people are on medication-assisted therapy through a van that comes to town once a week. It's a 2-person operation that doesn't have the bandwidth to be looking for if their strips are, or if their strip directions are accurate. So we took the time to develop that for them. We have those new directions. I have them available for y'all to download at the end of the webinar. Easy to cut. Let's make this as accessible as possible for people. And as Lieberman had touched on previously, was giving people the tools they need to actually use the strips. So many times I've done outreach with other organizations where a person walks away from the table with just the strip. If I'm at a music festival in the middle of nowhere, I don't have a measuring device. Maybe I'll do it in the pouch. Now it's oversaturated with water. Maybe it's not a deep enough vessel. So that paired with working in rural environments where there's a lot of stigma around not just drugs, drug checking, but also perceived risks with paraphernalia. So, you know, a lot of instructions you find online say cookers, stuff like that. Bottle caps are inconsistent as well. So we went with like little tiny measuring cups, like for cough syrup. They're like 2 cents each. It's the cheapest option, and it has all the water measurements you could possibly imagine right there on the side. Easy for somebody to use. They can do the strip in it. And then they can also say you tested cocaine in it. You could just drink the Coke after that, get your drugs back. It's no wasted material. The important part of not wasting your material that a lot of places skip over is something to crush your drugs with. If my bag is thin and it tears, I'm not going to risk tearing my bag as someone with limited resources. I'm not going to test my drugs effectively because I can't grind them down. So I don't want to waste all that. So giving somebody something to grind with. Double hitter, you can put your instructions on quality paper. So something to grind with, also the instructions, call it a day. They don't waste their material. And yeah, the scoops come in it now. I noticed one of the questions that was asked a lot is discreet for a lot of people that are worried about walking around with stuff like that. You can pack everything up in your little instructions, and it's really, really easy to distro. So, to touch a little bit on the data that we gathered about effectiveness, because through self-reporting, we were able to confirm with the lab, yes or no, if what people were self-reporting was lining up with what we're seeing. And we're seeing a surprising amount of accuracy on our end between the self-reporting with the end user and our lab. So 193 tested samples. FTS produced 0 confirmed false negatives, and every fentanyl positive sample was correctly flagged. So there is only a false positive rate of about a 7%. And then we know the medetomidine strip price issue is ongoing. Anybody that orders an individual kit, they do get a strip for free, but I convinced the boss to drop price down for everybody in the webinar today. We're going to go ahead and do $1.35 plus shipping per strip, which is just a couple cents above the wholesale that we get them at, because medetomidine is spreading across the United States, and people who use drugs deserve to know not just what they're taking, but also so that they can plan their come down and plan their withdrawal. that's something I have to do as a person that uses stimulants, is be like, all right, well, this will take this long, this, and this. People who use medetomidine, whether they want to or don't want to, should have that choice. And the strip is a great way, of course, I have an alarm set, is a great way to be able to consent at the point that they choose to consume. So with that, making your test strip kits, there is a spreadsheet that we put out. We have all of your kit links here, made it very, very easy for you to go and buy. I know there are people that are not currently working in PA on the webinar. Made sure that there's different types of strips and all that stuff available for you as well. If you're in PA, DDAP does provide strips to their statewide ordering forms, so that doesn't necessarily apply to you as much, but we have the zines, we have the scoops. Choose your measuring devices, what holds your liquid, based on what your participants want, what they're comfortable walking around with, what you're comfortable distributing. But you have variety here, which I haven't previously seen a lot of places. All right. Thank you, everyone.
Thanks, Carter. Hard to follow up Dr. Lieberman and some of my favorite colleagues in Rose and Carter. Thanks for having me on today as well. My name is Julia Hilbert. I have been providing technical assistance on this program for a couple of years. So I work for Prevention Point Pittsburgh. We turned 31 years old this spring. We are a syringe service and harm reduction program in Allegheny County, Pennsylvania, that seeks to improve the health and safety of people who use drugs with the provision of public health services in the Pittsburgh area. Obviously, Prevention Point distributes a lot of test strips and has been for a long time, as well as through our Next Distro mailing program. So this is an important topic to us. Really, almost everything we wanted to say about test strips has been said. So I just kind of want to give a brief overview here that I do technical assistance for the PA Overdose Prevention Program with Sam and our friends at DDAP. So if you need any support, especially as a grassroots or community-based organization that might be starting out your test strip distro, have some questions about how to reach the right populations, have questions about some of the more technical stuff that we got into today and how to answer those questions for your clients or your participants, I'm super happy to talk to you about that. We want to see more people expanding their community-based naloxone and test strip distribution efforts, but as Rose and as others mentioned on this call, people who don't use drugs don't need access to test strips. People who don't use drugs might want to carry naloxone in case they have the opportunity to be a good Samaritan and reverse an overdose, but they don't need access to test strips in the same way. So there's a little bit of nuance in our distribution of these two different products. So technical assistance can be for everyone on distribution strategies, the difference between types of products offered, reaching the correct people, brand and dosing questions. So please feel free to reach out to me anytime. My contact information is here in the slides. I'm happy to provide technical assistance, but with that, I'll just kind of pass it over and stay on to help answer questions that you all have during our Q&A.
Thank you, everyone. So now we have some time for Q&A. There were some pre-submitted questions, but you can raise your hand or put them in the chat. I see Alice. Or whoever had their hand raised.
It's me.
Okay.
This is something the WISE batch, I mean, Carter made the good point about different scoops, different colored scoops, but also different sizes. The WISE batch medetomidine scoops that are blue are smaller. I'm assuming they're 5 instead of 10 from looking at it, but thought that might be worth mentioning?
I'm actually in the process of getting the exact weights on that. I noticed that after opening a medetomidine strip myself, that it can fit into the microscopes that typically come. Yeah. Yeah.
And it looks like Dr. Lieberman has one available there to show us.
Bought a scale and everything to see. Yeah, there you go. Significantly different. You're muted, doctor.
Yeah. Yeah. So yeah, they are absolutely different size. Look at that. Doot, 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 doot. Okay.
So does that change the amount of water that you would want?
You know what? Now I'm gonna have to go and see how much they hold, right? If they're 5 milligram scoops, then I think the best way to use them would be to use 2 scoops so that you're getting the same nominal concentration of 2 mgs per mil. Yeah. And they don't provide, there's no volume measuring device at least in this version of their packaging. And so, yeah. Yeah, so this is one of that's a great example of how, the company's trying to do the right thing. They're trying to provide a measuring tool, and yet now we have measuring tools that measure different amounts. And so everybody's been saying, oh, use 1 scoop. And now we've got to like, oh, if it's a blue metatomidine scoop from Wise Batch, then you got to use 2 scoops.
On their website, they offer the medicine cups and the like pre-tubed saline that's measured. Does saline have any effect on results if you're using that?
Yes, so one of the things, a lot of the test strips, the sensitivity is better in in water that doesn't have a lot of calcium and magnesium. So like in South Bend, our water is off the scale hard. It's really nasty tasting, and so when we run tests in tap water, the limits of detection often are increased by a factor of 2 to 5. And so if you have access to deionized water or this sterile saline, that will probably give you better limits of detection. And I don't know, for Philly, I don't know if your tap water is hard or soft. But if you see a lot of like white crusty stuff around every single faucet in the house, then you have hard water.
Yeah, those are great points. Well, William, do you want to come off mute and ask your question?
Yeah, I just was wondering if there is any specific recommendation on what brand to use, like if there's any preference for BTNX or the Dance Safe brands.
I think personally, my preference falls in the manufacturer over brand. Because I mean, the brand is just the outside package. What's the strip on the inside? So there's SureTech that manufactures the BTNX Rapid Response, and then WHPM, which manufactures the Dance Safe, Bunk Police, Dose Tests. Do they also do Overdrive? Lieberman, do you know?
Yes.
Yeah, somebody else knows.
Yeah, and you
I
can
checked before we
differentiate
partnered
between
with them in another
manufacturers.
org.
You
So
can
there's-
differentiate.
Yeah, so the manufacturers they can make essentially the same product for 2 different distributors and just like slap different labels on them. But sometimes the different products actually are using different components. Like the manufacturer is doing sort of a bespoke manufacturing process, and one of the distributors actually is using a different antibody than the other manufacturer. So it's not like all the AssureTech products are exactly the same.
Yeah.
And then
They can vary a lot between lots and all that stuff, but WHPM has proven to be more consistent of a manufacturer at this time. Yeah, if I'm
yeah, I
recalling.
mean, I think there's certainly some distributors that have been more like cooperative and communicative. And that's really important when you're at an early stage, like if you're contemplating buying from a manufacturer, they should be responsive and willing to answer your questions. And if they're not, that's a bad sign.
We also had a question in the chat about what factors are most important when selecting drug checking technology for community distro. So like validation, sensitivity, specificity, data, cost, ease of use. So does anyone have any thoughts on that to add on?
I mean, I think that there's not a lot of drug checking technologies where that all that great analytical validation data is available in a timely way. And that's because academics are so slow, right? But it takes time to do the testing. It takes time to get a paper published. And then if the manufacturer is doing it, that's helpful. But you really want to like look at how they did the tests, because I can get whatever sensitivity, specificity numbers I want. I can get those numbers by selecting the samples that I test. If I'm the one that's designing that test. And so you really need to, again, I think maybe what Carter said about like talking to the manufacturer is is really helpful. I don't know. How do you choose which brand you're getting?
Vibes.
Vibes. We're doing vibe coding, so we might as well do vibe purchasing.
Yeah, Dance Safe WHPM packaging is speaking to my soul at the moment. It's got a little bit of orange on it. We're gonna go with this one.
For the DDAP risk prevention program, we have reviewed all of that and do review it to kind of, there's not like one over the other. It's kind of like weighing out all of those factors when allowing for brand preference. So, and we meet between DOH and DDAP to discuss. So
I think this is
our state's unique in the fact that we actually let people choose and that we actually allow options. I learned that from your strip drop-in, doctor, that a lot of states don't allow for that. You get one brand, that's it. You're stuck with it.
Yeah, so I mean, I think this is really one of the reasons it's really helpful to be when you're giving strips out, like see if you get information back about how are people using those strips, what are they working for, and that often is a way to find problems with particular products and maybe particular cutting agents that might be common in your area. So having the communication be sort of two ways, that's valuable.
yeah, I think that's a great point. The next person who has their hand raised, Colleen. Sorry if I pronounced it wrong.
That's okay, Colin.
Colin.
Yeah, so so my first question was gonna be, is there any test kits for thibenzodiazepines, considering the fact that they're legal and a lot of them, because they're polymer, do not pop with benzodiazepine test?
So you're not talking about like a Tizalam?
So some of them, like, yeah, so like
Sure.
Etzalam, Tizalam will, but then there's others like clonazepam and like fluoxazam that do not. So like, you know what I mean? Because
Right.
yeah. So has there been like, is there any test strips for that, or is it kind of?
So I don't know of any test strip that's specific for that. It sounds like that's kind of like that blind spot study, right? There's hundreds of synthetic benzos, and some of them are going to show up on a benzo test strip and others are not going to show up. And it is going to probably be brand specific, right? Because there's different antibodies out there. And so until somebody gets some pure material and does a limit of detection test, it's going to kind of be, you're going to kind of be at the mercy of whatever the company will tell you. So, but it's totally legit to go to, like, if you're using BTNX, you can go to them and say, have you ever done a study with compound X? And if so, what was
Okay.
the limit of detection? And
Awesome.
yeah.
I also think that's a really good opportunity for lab-based drug checking, which isn't always available. But if you're here in Pennsylvania, we have Groundhogs. We have a couple other programs around the state that do that. So like if you want to mail a sample off to the lab every so often, obviously it is not the same as point of care testing. You're going to have to wait a couple weeks to get those results, but you will know for sure what was part of that substance if that's something that you want to know.
Thank you.
I think there was a message in the Q&A when our client comes to us stating that one of their test strips came back positive. How do we have the conversation of next steps for obtaining the strips to send to the labs for confirmation? This is new information to us that we could mail positive/negative reading test strips, and we would love to start utilizing that. So Carter, I don't know if you could provide a little bit more about the...
So we do actual live material. We do not do trash checking. What is it? NIST and Lieberman, your programs are the ones that do that.
Yeah.
Yeah, we have
Yeah.
people mail in actual samples from their local supply to tell them exactly what they're taking.
Yeah, Nadia, I can do, so different kinds of confirmatory analysis labs are using different types of instruments. So a lot of people use GCMS instruments, and for that you need pretty high concentrations of substance. So that's why you need like a solid sample to start with. But I'm using a tandem mass spec, and that's really, really sensitive. And so we can extract drugs from a used test strip or a syringe plunger, an empty baggie, that kind of thing. So we call that drug trash. And if that's something that is interesting that you might want to do, then we could talk about that, because you obviously you'd have to talk to your people, right, who are going to maybe be providing the samples. You'd have to work out how are we going to get the data to you? How are you going to get the data to them? And then it's not going to be timely data, because there's all these, everything is in, you're waiting for stuff to arrive in the mail, and then we have to get time on the instrument, run it, analyze data, get it back to you. And so you have to be real clear with the people who are giving samples that they're not going to get the data tomorrow. They're going to get the data in 2 to 4 weeks, probably.
We always use it as a selling point that if you don't find your results particularly helpful this far out from when you submitted them, it's still really good data for scientists to have. So like just to be able to donate that off for you to even gather that information to be able to do stuff like this also has its place.
And for other people in the community, I think.
Are there any other questions that people wanted to ask?
Hi. Hi. My name's Caitlin. I'm with like a pharmacy. I know Carter. We were trying to, like, is there a way when we're having conversations and people are interested in like maybe sending samples? I came a little late to the meeting, so if you already said this, but like, is there like an information thing I could like maybe put in our basket of information with like our harm reduction education and supplies and stuff that they could reach out on their own too?
Yeah,
Or
I could get you some flyers.
okay, because we can also have this conversation stations too, but I'm sure a lot of people like they just visit the basket, take what they need, and that would probably be helpful. So, thanks.
There was also another comment in the chat. Could you also speak to the type of conversations you might want to have with someone if their drugs test positive or negative as far as next steps? So I'm not sure.
Well, positive or negative for what is a big starting point. What did they want it to be? What did it test positive or negative for is going to be what you are framing that around. But it really just depends. Like Dr. Lieberman mentioned, some people are looking to never use fentanyl. Some people are checking to make sure there is fentanyl in their bag that they might expect xylazine or medetomidine to also be in these days. So it just kind of depends. Are we talking about harm reduction for fentanyl, xylazine, medetomidine, some other substance? But you could just kind of go into the best practices of that thing. It is never a bad idea, regardless, to tell people to have naloxone on hand and not use alone, especially if fentanyl's in the conversation. But it really just depends on the substance, I would say.
I think, obviously the usual harm reduction, go slow, use with a buddy, have naloxone available. I think one of the things that I do usually stress when it does come to test strips is, when something comes back positive, like it is positive, negative, don't like positive is red light, negative is not green light. So don't necessarily equate those things. So just keeping in mind that like negative does not necessarily mean negative, and it doesn't mean negative for all of the things. So trying to make sure that people are cautious no matter what, what their test strips say.
Yes, I think those are great points. Does anyone have any other? All right. Well, we just want to thank everyone for joining us and through your engagement. We appreciate the work you guys do and every day to support overdose prevention, harm reduction efforts across Pennsylvania. So before I conclude, I do want to just highlight a few additional resources. So DDOP does have an on-demand naloxone training that is currently being developed thanks to Julia and Rose, and that will be available hopefully by the end of June in our training management system. So we encourage everyone to watch that and look for announcements to take the opportunity of that resource that will come available. We also, Alex had put in the chat, there's a test strip office hours the first and third Fridays of each month, and those sessions are excellent opportunity to ask additional questions, discuss challenges and situations, and learn from others working in the field. We also have some additional resources and reference materials and links that will be at the end of the slide deck for you to continue to learn and use. And I will send out the slide deck via email to all registrants following the webinar. And we will also have both the presentation and recordings posted on DDOP's webpage in the coming weeks. So I just want to thank everyone again, and we hope that you found today's training valuable, and we look forward to continuing to support overdose prevention efforts. And I will put the email in the chat if anyone wants to follow up with me directly, or a resource account for the overdose prevention program. And thanks again for the presenters who took their time today to share their valuable expertise. So we can stay on for another few minutes if anyone has any additional questions in the chat, but thanks everyone.
That was a tight 1:30. 17 seconds over. Not bad, kids. Not bad. There's a bunch of yappers here.
Good question. I'm going to have to go and measure these little blue jobbies.
I can't believe I'm ahead of you on that.
Yeah.
I'm actually like,
Often, you
I just
are
wanted to say-
you're the one that's using them, right?